Hello, this is a specimen of the uterus and it has been longitudinally bisected in the sagittal plane in the midline vertically. So let's first orientate ourselves. Over here is the anterior aspect. This is the superior aspect. This is the posterior aspect. And this is inferior. We can see at the cut section the vaginal cuff and the vaginal fornix posteriorly. Anteriorly, the vaginal cuff is not so clearly seen. Let's rotate this specimen. So this is the serosa, the posterior surface of the uterus, and here is the continuation of the serosa. It goes down a little bit more inferiorly on the posterior surface, and then it reflects off the rectum. This is the fallopian tube, and on this surface, we can see the ovary a little better. I'm just going to magnify it. So this is the ovary. And this is the opposite surface, which is the anterior surface. And for the uterine serosa anteriorly, it does not extend as far down inferiorly as it does posteriorly, because it is reflected off the dome of the bladder. So going back to this cut surface, we can see that this is the fundus of the uterus. This is the slit-like endometrial cavity. This thin layer is the endometrium. And approximately here to here, this is the myometrium. And of course, this outer layer is the uterine serosa. The main pathology is actually in the uterine cervix over here. And we can see that there is a large mass that measures about 3.5 centimeters in maximal dimension. It is tan. It has a fleshy cut surface, and on the ectocervical surface, we can see that there is ulceration and hemorrhage. And there appear to be some areas of cavitation as well. This is likely due to necrosis. In terms of the spread, we can see that the tumor involves the ectocervix and likely the endocervix as well, but it does not grossly involve the actual endometrial cavity. Looking at the vagina, we can also see that the tumor in this plane of cutting does not appear to involve the vagina. The diagnosis here is carcinoma of the uterine cervix. Most of the time, microscopically, this would be a squamous cell carcinoma, although we can also have adenocarcinomas of the cervix, and both squamous cell carcinoma and adenocarcinoma are associated with infection with high-risk HPV. So they have similar etiologic factors. And thinking about the clinical presentation for this patient, we can see that there is ulceration and bleeding in the most distal part of the uterine cervix or the surface of the uterine cervix. And hence this patient likely presents with abnormal vaginal bleeding and also very likely postcoital bleeding, because contact would actually worsen the bleeding. In some of these patients, because of abnormal bleeding, a cervical smear or a pap smear is done at the clinic, and this can actually cause quite severe bleeding. Staging-wise, we would want to assess whether this tumor is restricted to the uterine cervix or whether it has spread outwards into the vagina, as well as into the adjacent soft tissue. So this is the parametrial tissue just around the uterine cervix and also right up to the pelvic wall, and not forgetting the urinary bladder at the anterior aspect and the rectum posteriorly. In this different specimen, we can see the uterus, the tumor at the uterine cervix, the bladder, which has been cut open and split into two. And this tumor has actually involved the bladder and the ureteric outlets, and hence has led to hydroureter with subsequent hydronephrosis. So this is one of the complications of uterine cancer if it involves the urinary bladder. Hence, in summary, this is an example of a sagittally sectioned uterus, which shows a tumor involving the uterine cervix. This is a tan, fleshy tumor with areas of necrosis, hemorrhage, and surface ulceration. Thank you.